I'm Dr. Madan Thiruvengada, Senior Consultant Orthopedic Surgeon practicing at Apollo Hospital, Chennai. It's my pleasure to meet you all through this video. Here I'm to talk about this fast-track knee replacements. So what is this fast-track knee replacements all about? So a lot of people are curious to know what exactly it is. This is a new concept which we brought it in Apollo. So to benefit of the people who have been suffering from arthritis. So who are still at home and largely fear of COVID, they don't want to get it operated. This is what the concept was evolved for, where they can be in a hospital for a limited number of days. Say for example, within 24 to 48 hours, we are able to discharge the patient after the successful surgery. So, but the concept, who and all can get this kind of knee replacement is a challenging. So there is a pros and cons, and there is a selection criteria, so which I strictly follow. So that is why we can deliver them good results. So this is a concept of multimodal approach and evidence-based treatment. So with this concept, what happens is I do a pre-op assessment of all the patients when they are in clinic, check whether they are being suitable for this kind of surgery, and then we completely elaborately do all the tests as well and do the anesthesia assessment, and I start the physio well in advance as well, so that the process of rehabilitation becomes quicker and easier also when they go discharge at home as well. So as such, this is what the pre-op assessment is all about. And then when they come out for the surgery, after that all the assessments, they get admitted on the day of the surgery. So we operate on the early hours of the morning, so that protocol has been followed. And the surgical approach itself, it's a concept of less minimally invasive and less blood loss. So during the intraoperative period as well, I take a lot of precautions on how to assess the soft tissues and how to keep the blood loss to minimal, and pain wise as well, how to keep the minimal pain for the patient as well. So once this procedure is done, so I give some certain blocks to the points in the knee as well for the pain relief. And immediately when they've been going to the rehab, not the rehab, I would say that going to the post-op ward, they have been mobilized immediately by our physiotherapists. So this is not a me concept, this is a whole concept of a team working together to get you all better, okay? So the same day they are mobilized without much pain. We got a good results, and we got a good number of patients who have been satisfied with this procedure. So early mobilization, what happens is they get a confident. Patients feel better, and then they get confident as well. So they see that after doing a major surgery, they are able to walk independently as well. So of course, for a few days, they would need some support on that walking as well with walking aid. So as the hospital stay is minimal and less risk for the patient as well, the psychological stress of the surgery is also reduced because they are more into the home environment as quick as possible. So it's not just discharging a patient, operating and discharging a patient alone. So our thing doesn't stop there as well. So what we do is we have a strict regime of post-operative care with the physiotherapist as well. I strictly monitor them and make sure they're all comfortable even after the discharge as well. Since this whole procedure is done within a short period, it becomes more cost effective as well and higher patient satisfaction as well. As I did mention about, so we got a good home monitoring system and physiotherapy rehabilitation process as well to take care of the process to go in a smoother way as such. So as such, I was talking about arthritis. Why do we do this fast-track knee replacement? So what happens during the COVID period is a lot of people has been suffering due to pain, and then they say that it's not safe to come to the hospital. So that is how this concept has evolved. It's been doing for 2 years. This is the first time we are introduced in Tamil Nadu as well. Last year I did it. So it's been going successfully now for over a year at Apollo Hospitals, Chennai. So as such, let me give a few glimpses of what arthritis is all about. So arthritis is as a wear and tear happens in a knee joint. As you see here, this is a cartilage. The blue color is the cartilage, which is a lining of the end of the bone. So this surface should be smooth so that the joint glides in between. Two joints are in contact and then they glide smoothly between two together. So what happens is as the age process goes by, this cartilage gets brittle and then broken over. So these are the different stages which goes on. Once the cartilage is completely gone, that is where the deformity also comes in. So patients have difficulty in walking, even doing their day-to-day activities is become uncomfortable for them. That is where the stage we need to ask ourselves whether how we can help the patients to get better and get to normalcy as quick as possible. That is the stage I offer them with knee replacement. So this model, you can see this is the knee replacement done. This is metal and metal. Inside between that is a liner. Okay, so we got different types of knee implants. This is oxinium implants. This is a little bit more expensive side as well. The advantage is for the metal allergy patients, I use this kind of component as well. So this is all time and tested, and it's all long lasting as well. So any surgery is done in a correct way, in a correct method, so they can last by about 15 to 20 years of the period. So I believe you will all be benefited by this video. Thank you very much.